So this is the segment where we bring together the ecosystem of obesity care, where we bring together the clinical leaders and the patient advocates and the community engagement folks, all to talk about this global recognition, but in a way that allows us to understand how obesity matters has actually shaped the way that they treat or they communicate with their community. And I think that Jillian's going to introduce our first. We're going to do it in 1 to 2 minutes
1 to 2 minutes
for each of us. Yeah.
Obesity Matters is such an amazing organization because so many different people from different walks of life, different experiences are all involved. And so to begin, I'd like to welcome up to the stage Al Martin and Angela Martin to say a few words. They're our community advocates. You can do whatever you want.
Okay. I'm not good at sitting down. I do that at work. Am I supposed to have a mic?
You do now.
Does anybody want me to have a mic? You could know.
Nope.
I'm sure you have something better to say than I do.
Nope, you first.
All right. Well, I think I was told that I should say what obesity matters means to me, and it means a lot to me. It's something that's relatively new to me. I think I've been working with these folks here for maybe a year or so. It's not my first time I've been involved in patient advocacy, and it's often excuse me, it's often something that's missed apparently, which I didn't realize until I started seeing issues in the medical field, which is not a field I'm in, is one where I was a patient and I would interact with different people there. And, you know, I've realized there's some great people doing stuff here, but some of this is broken. Some of it isn't working. And we only have a couple of minutes, so I'm not going to tell my whole story. I'm just going to say I realized there were some cracks that people and their issues, their diseases, their medical conditions were slipping through. And I didn't even realize at first that I was living with a disease called obesity. And then when I came to realize that and how much it was affecting me and my life and my day-to-day, everything is affected by it. It does matter. I matter and all of you matter. And the medical industry as a whole wouldn't exist without patients. And so when we get a chance to come out and speak to people and say, there's something wrong, I feel really bad about saying that, because when you come to a place like this, any medical professional that showed up here, there's someone that truly cares. I matter to them already. They get what counts. They know what we're made of, and they know that we're more than just our excess adiposity. They know that that's not who we are. But I've had so many experiences where that was the only thing that was seen. And I realized that it was affecting me and how I felt about myself, which is not something I felt good about right from the outset. I never felt good being the big kid. I never felt good being the big teen. The only time it was ever any good was when I played football and rugby, because I was bigger than people and I could knock them down or hurt them or whatever, which was a very laudable goal, to hurt other people. That was my first contribution to the medical industry. Just create a few patients. But then I started getting sick in my early 20s and realizing I had issues. And I realized issues I had that had nothing to do with my excess adiposity were being blamed on it. And I was being sent away, being told, everybody can say it with me, you know what to do. You know what to do. And apparently I do, because I'm watching the presentation here, and I want to say I'm way too loquacious to get up on a stage with a microphone. But I'm seeing these things, and I'm like, I've been doing this for decades now. My food should come from the outside of the grocery store. And most of the food that my wife and I buy comes from the outside of the grocery store. And some of it comes from the middle of the grocery store. And maybe a few too many things come from there. And I try to spread my meals out throughout the day and not just have one or two big meals a day, which is hard sometimes in the business that I'm in. It was harder in my old business. It's just tough to do. And I've tried to make all these little changes, and I see all these things, and I add a little bit every time I see something that I can do. I try to add it in. And overall, I've gone from 405 pounds to 335 pounds, which is something that people should be excited about and happy about. But the thing is, I wasn't, thank you, but I'm not a better person now than I was then. There's less of me, in fact, which is apparently a good thing. And then at a certain point, it tips over. But I want to say that the most important thing to me is to get together with a group of people like Pretty and Sandra and all the people they bring together. And I think about this whole, what matters is the people that have been involved, and there's people that have been involved in so many things, and you have these events. And I remember going and talking to folks at the old mill not so long ago. I guess that was in the spring, or maybe it was the summer, but it doesn't really matter. It was June. Is June the summer? Sure it is. We only get 3 months of summer in this country. Let's enjoy it. So I go to something like that, but there's these online things where, I don't know if they're seminars, they're meetings, they're groups, and they are a mixture of all these great things, question and answer sessions, things like what we just saw with the tomato sauce, a cooking demonstration, a little bit of a chance to chat, to ask some questions, to see a specialist, an expert come and speak. And I was able to participate a couple of times by asking a question, making a comment, but most of the time I was in my truck and just listening. And I think back to this whole thing, and it's like, was that the best thing that anyone could ever do? Bringing a little bit of knowledge to everyone every few weeks. I can't remember, was it every 2 weeks? Was it every, I don't remember how often it was, but I would get the email, I would click it, and I would go on there, and I couldn't make it a lot of times, and it made me sad. But it mattered to me that it was happening. And that's, obesity matters, not just because I live with obesity, but because we all, whether we live with it, or trying to treat it, or trying to support people living with it, whether they're members of our family or friends, it doesn't matter. We matter, and we need to do something to make this better. And the last thing I want to say is that I grew up in the East End of Toronto in an area that was populated hugely by people from the Mediterranean, including my next door neighbors who were Italian. And I didn't know you were going to make tomato sauce, but my neighbors, when they would get, every summer, they would bring all these tomatoes out, and they would bring them out by the bushelful. And they had a huge pot. And in their backyard, they would light a fire under this thing, and it would cook the tomato sauce. And they made it just like you showed us. And they made this in their backyard. And the day they made it, they were jarring it and saving it, but they also would make these amazing sandwiches on Italian bread with like breaded chicken cutlets and the sauce right on. It was just beautiful. And I love seeing that demonstration. It brought me back to when I was a little bit smaller, but I was a lot younger. And thank you for letting me say a few words. And thank you, Pretty, for letting me come here and talk.
I'm not sure it was a good idea to let you go first.
I know.
You had a lot to say, and it was
You should have
very
said it.
meaningful, very meaningful. A little bit of a different story for me, but meaningful all the same. When did I come across the Obesity Matters group? 3 years ago. I just moved to Toronto, and I worked from home solely, didn't have any connections to the community. And lo and behold, as I'm doom scrolling one day, it showed up. I let the AI algorithms sort of show Obesity Matters. I go, what's this? In person? Oh, this sounds like my kind of group. Showed up at, it was the first event, I think. And I showed up, and Pretty was right there at the door. She goes, welcome, come in, you know, the way she does, lets everyone in. And she gives me a hug. What's your name? Can I get your name card? Dr. Macklin, you were there, I remember. And I'm like, I kind of felt like welcome right away. And I looked around, and I remember listening to speeches from, I don't know if you spoke there, but Dr. Macklin spoke, a bunch of other people spoke. And it just kind of got me feeling like, am I in a place where I actually belong? Because you've been at a patient end of things where I've been very supported by my healthcare, very supported by my doctors. I've been very fortunate. But for me, it's been the social stigma. And I think it's mostly, I put it on myself. But just hearing people being name called my whole life, like from wee child, I've been this tall since I was 9 years old. So I've also been a very tall girl. I stopped growing, thankfully, because I thought I was going to be a giant. But regardless of that, it's the social aspect that's always stuck with me. Every time I go somewhere socially, I want to fit in. I don't want to stand out. But I have the standout personality. I am a standout girl. And what this group has brought me is a voice. It has brought me a voice and confidence I've never, ever experienced in my whole life. And to stand up and say, you know what, I do matter. And this does matter. I tell everyone that I'm involved with this group, like, I'm proud of it. And people are like, oh, wow, what do they do? Like, it's bringing knowledge and awareness. So that's what this group has done for me. And I mean, I kind of think about, like, I know we talked about that we did the red string theory at the last summit, for those of you who were there, that we're all kind of connected. And I think somewhere in this algorithm of the universe drew me to that first meeting. And I see how all of our lives are interconnected and how it brings all of us together, no matter what, whether it's coming from a patient standpoint, whether it's coming from a social standpoint. We've all lived with it. We've all experienced it. We've all witnessed it. And now we're here saying, you know, this does matter. And that's why I am here every single day. I'm a patient advocate. I speak up for those who cannot and won't, and just offer that out to anybody who's out there. So when I saw this award that you guys got, it was no surprise to me. You might have been shocked, but I'm like, yeah, they're getting recognized for the work that they're doing. And I want you to know how amazing you are, and you bring people together. I could just wish to be half of you. It's incredible. So congratulations. Thank you.
Hello. Thank you. Those are beautiful testimonials. Thank you very much for sharing that. What I really loved about both of them was that they spoke to the essence of Obesity Matters, and how Obesity Matters is really about a community-based approach to stigma-free care. And so I really value the input of both Al and Angela. Thank you for that. And so the next two folks that I want to introduce are really important people to me, because they were mentors in my almost 10-year journey with obesity medicine, Dr. Sean Wharton and David Macklin. And so what I want to say about them is that they are global leaders in the field of obesity medicine. They contributed highly to the clinical practice guidelines and how we treat obesity and in Canada. And not only in Canada, because I recently found out that globally, Canada sets the standards for guidelines, and now other countries across the globe are actually using the Canadian guidelines as a template for how they treat obesity. Like, these are the people we have in the room. These are the experts. But aside from that, that's not what actually makes them special. They are special because they're just genuinely kind humans. They're constantly always staying in touch with whoever needs to be spoken to about obesity medicine and how to do this work properly. But they also represent people who bridge the gap between the patient experience and the physician awareness about how to actually speak to patients about weight management, and dismantling the bias that surrounds it, and in ensuring that we actually envelope our patients in love and care in the way that they deserve. So please, if you could just come up to say a couple of words about how Obesity Matters have shaped your perspective.
That'll be easy for me. I'll just put them together. So I was recently at an very significant obesity conference last week, and I'm sitting at lunch, and I'm eating a sandwich, and a low carb guru comes up to me, well-known, and he's like, Macklin, you know that stuff will kill you. And I said, my grandmother lived to the age of 98. He said, by eating carbohydrates? I'm like, no, by minding her own business. And so, but the point is, if you're someone living with obesity, really, in a way, your experience often in healthcare, if not always, is that the physician should just be minding their own business. If you want to mind my business, recognize me and recognize what I live with. And so I travel the world and spend a lot of time training clinicians to do something very straightforward. And Obesity Matters stands for exactly this. I invite clinicians to, and get this, I know this sounds wacky, like it's outlandish. I invite them to actually listen to their patients when they ask them a question. I know, so far that sounds very unusual. And then I ask them, once they've listened, to actually make sure that they've next summarized back to the individual what they just heard. So why is that so important? Because people with obesity are very, very used to not being listened to. And it can be a remarkably validating experience for someone in a white coat and a stethoscope and a physician to just lean in and say, so what I hear you saying is, or correct me if I'm wrong, like what I just want to make sure I have this right. And then really summarizing back what you've heard. And what that ultimately does is it establishes what I suggest is the only obstacle, and this is kind of my messaging globally, the only obstacle left in successful and effective support for people living with obesity is the relationship between a clinician and the person living with obesity. I sometimes get into trouble when I say, actually, the condition, the true genetically conferred, brain-centered, real progressive and environmentally influenced medical condition is actually not a complex condition, and treatment is not complex. The complexity is if you as a physician are not relating and instead bringing bias and stigma to the relationship in the clinic. And so Obesity Matters really stands for that. So if the award really kind of means anything, it means the recognition and the respect for what is really the most discriminated and stigmatized individual in all of healthcare, which is the person living with obesity. And that should end someday, God willing, very soon. And Obesity Matters is receiving an award for really moving the needle on exactly that. So congratulations to you guys. Yeah.
This is terrific. I'm very proud of Priti and Obesity Matters. From the days that we started it as the CON YYZ, the Canadian Obesity Network, YYZ group, and then moving on to Priti and team really recognizing that the core of this is the patient-related aspect, not a lot of the physician aspects and the allied healthcare, which a lot of us were, and we really had a lot of ego. And the ego was really driven by if someone's sitting across the table from me asking me what to do, I'll tell them what to do. And I'm in charge and I'll instruct them. And that's really where a lot of obesity medicine started and still is. When we wrote the Canadian Obesity Guidelines, we started to recognize that that's not where obesity medicine lives. Obesity medicine really lives with the patient focus and trying to understand what that is and listening to them and summarizing and inviting them to hear other things. That's completely foreign for doctors. People need to really understand that. It's not easy for us to actually do that. And what the Canadian Obesity Guidelines did was to turn the focus away from what we normally do on our slides, which is a focus of the patient living with obesity and arrows about all the diseases that they have and the adiposity that lives in this area. We always love talking about the patient and the disease. What the guidelines said is we're not going to talk about the patients and the disease first. We're going to talk about you first. You, the doctor, we're going to turn the focus and the arrow back onto you and tell you that you're doing a crap job. You're doing a crap job of not listening to your patient, exercising your bias as opposed to stifling it and trying to understand the person that is across from you. And that wasn't fun for them. They did not like that. But that's the first chapter's bias and stigma, and the focus, the camera is turned back onto the physician, the allied health professional who's doing a bad job. once you get past that and you understand that, you have humility, then you can get onto the science and some of the research, which is easier to understand because that's what we do. But then always continue to remember the humbled aspect to that we don't understand the body, we don't understand all the biology, we don't understand all the aspects, but we do understand very important things. That it's painful to be to be discriminated against. It's painful to have stigmatizing images and aspects. It hurts. So it's easy to understand something that's painful and hurts. It's not always easy to understand all the biology. So if we remember that, and if you remember that for your physician, that they're not accustomed to the lens being turned on them, but remind them every once in a while, and sometimes be kind to them as they're learning, but remind them that you're the focus and obesity matters, and that they can do a better job. I know they can. I've seen it, and we're on a new path to make things better. So Obesity Matters. Congratulations to you.
Thank you for that, Sean and David Macklin. Thanks for highlighting also, Dr. Wharton, that Obesity Matters is unique in the sense that we take a top-down and bottom-up approach where we give access, we provide access to clinical expertise like the two folks that you just saw now, but we also enrich or empower the patients to really advocate for themselves when they show up into a doctor's office. And if they're not getting that love and warmth from the doctor because they haven't read the Obesity Canada Clinical Practice Guidelines, that somebody like Angela, you said so eloquently that you can actually advocate for yourself now and you have the confidence to do it. And I think that just speaks wonders about the community aspect of the program and the workshops that they provide. So there's a lot of industry leaders here tonight. So you guys gotta buy into that workshop because this is what it's creating, right? We're giving patients and individuals who matter care to evidence-based clinical practitioners. And so the next woman team I would like to invite to the stage is somebody I met a couple of years ago. So it's the Gina Livy program. Gina Livy and your team, your entourage. I remember seeing you at an obesity summit, and you just walk around with this hive of people who just are just emanating positive energy. And so when I've been invited onto your podcast to speak to your audience, like I've been on TV shows, I never get as many followers as I do when I go onto the Gina Livy program. No, and people recognize me in public because I've been on the Gina Livy program. It's crazy. So the following you have is so warm and inviting. And I think there's such alignment with your team, with Obesity Matters. And I'm so glad that you are involved or we have a relationship with you because that really is an honor for us to be part of your hive and for you to be ours. So do you mind coming up to just say a few words? Thank you.
My goodness. Okay. Well, first of all, Preeti's like, oh, you just come, you'll stand up, you'll say something. This is on stage. This isn't, I am just honestly honored to be in the room. I mean, I can't, what? Yeah. I mean, so I've been helping people. I've been in the weight loss space for 30 years. Didn't take me long to realize it wasn't just eat less, exercise more. I had my own weight issue myself, and I got really good at helping people understanding what they need to actually make change. And so I thought, okay, well, I'm going to go to the obesity conference in Whistler and go find out what it's all about. And boy, my goodness, was I intimidated. And I remember Sonia, my good friend Sonia, who works with me. She was outside at the pool and I was in the gym. And she's like, you got to come out. Oh my goodness. Sean Wharton and Sandy Van, they're outside. I just met them. So the story goes, Sonia's at the pool. Sean Wharton strolls up and says, hey, can I have this chair? And she's like, absolutely not. No, it's from my friend. She's inside. And then he happens to see the presentation that this amazing woman, Ruth, and her team from the University of Ottawa were presenting. They've been studying the Livy method for a while, and Sean was like, "Oh, what's that?" And takes a look. There might have been some spelling mistakes, but like, okay. Sean Wharton, he's taking a look. I come out, I'm like, "What's going on?" And Sandy's like, "I know you." Sean's like, "I know you." And I couldn't believe it. I couldn't believe it. And so we got to talk. I got to meet Sandra. I might have stalked her for the whole conference. She's like, okay, she knows people. She was lovely. I remember sitting beside Preeti. You probably do not even remember. We were sitting on a chair beside each other. I think we were eating buffet, nowhere to sit. And so I sat down beside her, and she was telling me what she was doing. And never in my life would I have dreamt that I would have been here years later. And you have all been so welcoming. Like I all been so welcoming. It's such an honor. So for those of you who don't know me, I run these large communities. And it's probably the thing I'm most proud of is the community. It's providing a safe place for people to work towards their goals. And everybody's goal is personal and it's profound. And, you know, what's hard is life. So they're trying to lose weight. They're trying to reach their goals. They're trying to do it in a healthy way, a sustainable way, when life is smacking them in the face. And, you know, they're looking after their kids or their aging parents or what they got going on at work. And it's just so much more. There's also their issues and associations, trying to have lost weight for so many years and feel like they've been successful and have it taken away and they gain it back. And I've been so lucky to have Sandy and Sean and Sandra come on in my community and talk. That means that the people in my community have access to, like, it's supposed to be a half hour, but I always push it longer. It's like an hour-long conversation with the brightest minds in this space. And it just means so much to my community. You really have no idea. They feel seen, they feel heard, they feel validated, and most importantly, they feel hopeful. And you're not just all really smart, you really care. And I had an opportunity, I was also at that conference that David was at, which was so cool to see you there. Again, I have no business being there. I'm not the science part of any of it. But I go because I want to be in the know and I want to do my part. I really want to do my part and I want to do it right. And I had an opportunity to sit down with Sandra and Preeti a few times and talk about people whose heart is in the right place. It almost seems too good to be true. And I just want to say thank you. The work you do is so important. It's so important. And I want to do my part and make people and share and let people know there's so much support and resources available to them. And I don't know that they knew that before. So I just want to say congratulations. You are good people doing good work, and it absolutely matters. Absolutely matters. Thanks.
Wow. Isn't it amazing to hear the stories from so many different perspectives? I think that's one thing that's so unique about this community is how many different backgrounds and voices. And so we're here tonight to celebrate Obesity Matters Award. And for those of you who don't know the process, they actually have to get nominated. And so I think it's one thing when we talk and we celebrate, but there are two people that actually took time to nominate Obesity Matters. And so I'd like to call up Evelyne Bergevin, and I'd love for her to share why she nominated Obesity Matters for this award.
Hello, bonsoir. Parce que si c'était juste de moi ce soir, je parlerais en français. But tonight we're talking in English, so that's why I'm gonna be reading because my brain at this hour isn't as fluent as I would like to be. So, as a registered dietitian in Quebec, I've seen firsthand how weight stigma, grossophobie, continues to shape the way people living with obesity are treated. Time and again, I've heard healthcare professionals offer the same simplistic advice: eat less, move more. But as someone who is trained in nutrition and obesity, a couple of years ago by Sandra, by Sean. I'm a groupie. If Swifties were something with Taylor Swift, I would be definitely. So yeah, I'm already a little stressed to talk in English, but now I've got those amazing faces in front of me. Whew. Okay, so as someone who's trained in nutrition and obesity, I know this is neither a sustainable nor evidence-based solution for people living with a chronic condition. As a dietitian, I know sustainable change doesn't come from shame. Obesity Matters and its French initiative, Parlons Obésité, that has been started in last October, offers a consistent and respectful alternative to the judgments too many patients still encounter in clinical care through bilingual newsletter, virtual community, and workshops. Their free, inclusive, and science-based programming addresses not only the physical aspect of health, but also the emotional and systemic barriers that often go unacknowledged, and makes their work valuable in Quebec in their commitment to bilingualism, community-based support, and stigma-free approach rooted in empathy. Obesity Matters is more than an organization. It's a movement for dignity, science, and person-centered care. They, all of you here tonight, challenge stigma, foster community, and elevate critical conversation about obesity, especially in a province where recognition of obesity as a chronic disease is still lacking, and where essential medication remain excluded from the RAMQ formulary. This UN award is a well-worthy recognition of all the hard work that has been done, and I cannot wait to see what the future holds. So thank you, Pretty, for letting me be part of this great organization, and congratulations to all the teams.
Thank you. So the next nominee, he's actually not here tonight, but I know he would very much want to be. He's been one of the most consistent, active supporters of Obesity Matters since day one. And so we're actually going to play a video of Dr. Naresh Aggarwal, and he has some words to share.
Good evening, everyone. I'm Dr. Naresh Aggarwal. One fine Wednesday, while having lunch at my desk and browsing through my emails, I came across a wellness workshop hosted by Obesity Matters. What I saw that day was truly amazing. For the first time, I witnessed a large support group of people living with obesity coming together, sharing, learning, and connecting. Even more inspiring was the fact that the group was led by individuals who had lived through their own journey with weight. Participants had joined from all across Canada and even from other countries. So often, this journey is lived alone and in isolation, trying to escape stigma, sometimes even from their own family, friends, and medical community. What struck me most was not just the topic being discussed, but the interaction between the participants and organizers. People felt comfortable asking deeply personal questions, and every time the response was met with genuine love and compassion. Obesity Matters has built up a community like no other, a place where countless people have found the companionship and support they never had before. I have been a family physician for over 40 years, and I'll admit I often felt frustrated trying to treat the chronic disease of obesity. But the advent of newer medications and organizations like Obesity Matters has renewed my hope and passion. In fact, it has inspired me to pursue my own ABOM certification. When I came across the application for United Nations Interagency Task Force Award for Non-Communicable Diseases, Obesity Matters was the obvious choice. Organizations like this just don't complement our work in research and clinical care, they complete it. In my work conducting weight management trials with the pharmaceutical industry, they always talk about being patient-focused, but too often the focus gets diluted because of other pressing priorities. If anyone is listening, please consider following the Obesity Matters approach because they truly put patients first. So tonight, as we celebrate I want to thank you, Obesity Matters. Thank you for doing the kind of work that may not always appear in journal articles, but shows up in people's lives every day. Congratulations on this well-deserved award and many more to come.